Hi, this is Dr. Swapna and I welcome you to your Learn Lab. If you are an IGNOU student looking for help in your studies, then you have reached the right place. Here, we have lecture videos on different core and elective subjects of important IGNOU courses. We aim to help you ace your exams. So hit subscribe to our channel and as you watch, make sure to like and share too. Come and join me on this beautiful learning journey.
In this video, we'll be continuing with Block 1, Forensic Psychology and Introduction. And we are dealing with the last unit of the first block, which is the third unit, Assessment and Evaluation in Forensic Psychology. So, when we talk about assessment and evaluation in forensic psychology, we are basically talking about the use of psychological tools and techniques that we have already studied to help the legal system make fair decisions. So, forensic psychologists assess people involved in legal cases, for example, like defendants or witnesses or even victims, to understand their mental capacity, behavior, and risk level. So, here the key idea is that the results of these assessments are often presented in court and can influence the judgment of a case. So, this topic helps us to see how psychology supports justice by providing objective insights about human behavior. And by the end of this unit, we'll be able to explain the role of assessment and evaluation in forensic psychology, describe the tests and evaluation techniques used in forensic settings, and discuss the personality testing and its significance in legal contexts. Assessment and evaluation in forensic psychology are very similar to what we do in general psychology. Only here the purpose is different. Here the purpose is legal. The results may decide whether someone goes to jail, receives treatment, or is considered mentally unfit for trial. Alright. So, assessment and evaluation in forensic psychology are similar to general psychological evaluation but have legal implication. Results are often submitted to courts and influence the judicial decision. And what is this used for? This is used to assess the mental capacity and functioning of an individual, and this individual is mostly involved in a legal dispute or a case. The competency to stand trial, whether the person is mentally fit to face the trial, right? And also the future risk and criminal responsibility, whether the person will or may repeat the crime or may do another crime or is a risk to the society. So this is the general purpose of the psychological evaluation that is being done by a forensic psychologist. For example, imagine a case where a person commits a crime but claims that they were mentally ill at the time. Okay, you might have heard about this in movies and all, where a person is actually committing a crime but then they say that they are mentally ill and whatever they did was not in the sane state of mind, right? So in such cases, a forensic psychologist evaluates their mental condition to see whether what they are saying is true or not. Okay, so the forensic assessments or the assessment of a person's mental situation by a forensic psychologist always have legal implication and are often mandated by the court. All right. So a person cannot go and have a psychological evaluation by forensic psychology. It's almost always initiated by the legal proceedings. Let's see what is the role of assessment in forensic psychology. So we studied in our first unit what is forensic psychology, right? So we saw that forensic psychology lies at the intersection of law and psychology. So forensic psychology stands where the law and psychology meets or at the crossroads of law and psychology. The main role of assessment here is to provide objective evidence-based insights to help the courts to reach a fair conclusion or a fair judgment about a case, right? So the some common purposes or common uses of psychological assessment here involves determining criminal responsibility, checking if a person is actually competent to stand trial, that means whether they understand the court process and can defend themselves or not, and assessing the mental illness or malingering. Malingering means whether the person was actually pretending to be ill. He is not ill but acting like he is not mentally ill. That is malingering. So the assessment in forensic psychology is also going to help in evaluating whether the person is actually mentally ill or they are just acting as if they are mentally ill. It is also going to help in predicting the future risk of violence or reoffending, which is also called recidivism. Alright. So the first main purpose we have is determining the criminal responsibility, that is whether they knew right from the wrong when the crime was committing, whether the person was actually doing it intentionally or by mistake, or was it because of the situation, right? And then to assessing the competency to stand trial, whether the person is mentally sound enough to understand the court process and can defend themselves. Evaluating whether the person is actually mentally ill or just acting like they are mentally ill. Also to assess the future risk of committing the crime a second time. In India, such evaluations are often used in cases. So now we have the new code of law, right, which is like Bharatiya Nyaya Samhita and all. So earlier when it was IPC, we had section 84, which was the insanity defense. All right. So this is the main role of assessment in forensic psychology. Let's now look at the key characteristics of forensic assessments. Let's understand what makes forensic assessments unique. So the first point would be client. In clinical psychology, your client is the patient. Okay. In forensic psychology, the client is usually the court or the legal system. So here you were not directly involving with a person, but the whole legal system. That is the first and foremost difference or the key characteristic feature of forensic assessment. Second is the goal. Okay, in forensic assessment, the goal is not therapy. It is to answer specific legal questions objectively. Okay, so first one, the client is not a person or a patient who needs treatment. Here the client is the court or the legal system who wants to know whether a person was mentally ill or should be given a punishment or not. And second, the goal is not therapy. Here the goal is to answer specific legal questions objectively. Third, nature. These evaluations are ordered by the court and are not voluntary. As I told you before also, not just anybody can go and ask for a psychological assessment by a forensic psychologist. For that, the court has to order this to happen. So that is the nature. Evaluations are often court mandated and not voluntary. Finally, focus. The psychologist here must stay neutral, use verified tools and cross-check all data for accuracy, right? As in the other case where the clinical psychologist, the focus is to help the patient, right? Here the focus is not to help the patient but to help the court or legal system come to an objective conclusion. So the psychologist has to stay neutral, right? So these are the 4 characteristic features of forensic assessment. So if a question asks how forensic evaluation differs from normal assessment, remember the keywords here would be objectivity, court mandated and legal purpose. Alright. Let's quickly here tabulate the difference between forensic and therapeutic evaluation. Okay. So the first point or the difference or the aspect would be scope. The scope of therapeutic evaluation is very broad, where you're going to assess the person, find treatment for the person, and it's very long-term process also. Where the forensic evaluation is very narrow scoped, which means here the intention is not to assess or help the patient. It's to assess the mental state of the patient and help the court to come to a conclusion. Alright. So the scope of therapeutic evaluation is very broad, which means it includes a lot of things. But when it comes to forensic evaluation, the scope is very narrow. Very few things include here. Secondly, the purpose. As we all know, the purpose of therapeutic evaluation would be treatment and diagnosis, while for forensic evaluation, it is legal decision making. Then the client, when it comes to therapeutic evaluation, is a voluntary patient. But here, under forensic evaluation, the client is someone who will be there by the order of a judge or an attorney. Then the focus of the therapeutic evaluation is the well-being of the client, while here, when it comes to forensic evaluation, here the well-being or the ethics or the confidentiality of a client doesn't matter much. What matters is the objective truth. Okay. Then the relationship between the therapist and the patient under therapeutic evaluation is empathetic and supportive, right? While when it comes to forensic evaluation, the psychologist cannot be empathetic or supportive of the person because the person might be a potential criminal. So the psychologist or the evaluator has to be neutral and evaluative. instead of being supportive. Finally, the outcome of a therapeutic evaluation is a therapy or guidance, while under forensic evaluation, it is a report or testimony which is going to help the court of law. Alright, so this is the difference between forensic and therapeutic evaluation. Let's now look at some of the tools of forensic assessment. When conducting an assessment or an evaluation, forensic psychologists use a combination of methods. It may not be just one method. Let's look at what are those different methods. First one would be interviews. So we know what is interview, right? We have studied the different techniques that are being used for evaluation and therapy in our other papers, right? We have studied it extensively in second year also, right? So we have different types of interviews. Could be structured interview, where you are predetermining every single question and the order in which it has to be asked. So it's very pre-planned method. It could be semi-structured also, where questions are already planned, but it's flexible, wherein you can add or remove questions as per the situation. Okay, so structured or semi-structured interviews could be used. And example here is competence assessment for standing trial. Okay, this is a type of interview that is used under legal settings. This is called CAST or CAST bar MR. So the full form here is competence assessment for standing trial. All right. Second is behavioral observation. This includes watching how the person behaves in interaction or maybe interrogation. What is their tone, what is their posture, what is their emotional control, all of this. In short, you are analyzing their demeanor, which means the behavior of a person, how the interrogation or questions are affecting the person, and how the person is responding to all the questions, and the law or the legal personal around him or her. The third one is psychological tests, and we have studied about psychological tests, right? They give measurable data about personality, intelligence, and disorders. It is also going to tell whether the person is actually acting like mentally ill or not. So this involves malingering tests also. So we can have personality tests, intelligence tests, malingering tests, all sorts of these tests, which are going to give a measurable data about all of the characteristics that are being tested here. Then fourth, we have collateral sources. These are sources which are going to be used in addition to the other psychological tools. This includes the family reports, medical records, or police files, or even third party reports which are available about the person. Fifth, we have the mental status examination or MSE. This is a short assessment of appearance, mood, thought, and orientation of the person. It is the evaluation of the cognitive and emotional state of the individual. So we have 5 important tools that we use generally for forensic assessment. First is the interviews. It may be structured or semi-structured. Example is competence assessment for standing trial. Second is behavioral observation. You will be observing the behavior of the person, their tone, their posture, their emotional control, their response patterns, all of that. Third, we have the psychological test. We will be using standardized psychological tests, in fact, for obtaining measurable data about the personality, intelligence, and other disorders of the person. Then we will be using other sources also, like family reports, medical records, third party reports, or even police files. Finally, we have the mental status examination. This is a short assessment of how the cognitive and emotional state of the person is before the trial. So these tools together help form a comprehensive and defensible report about the person. Some of the commonly used tests in forensic psychology. Okay, so these are some of the standard tests that are used worldwide and also in Indian forensic setups. And these include the Minnesota Multiphasic Personality Inventory or MMPI 2. It is going to detect the psychopathology and malingering. I told you already what is malingering, right? It is behaving or acting as if the person is mentally unstable while the person is actually stable, quite stable. Or the psychopathology, why exactly the person is having that psychological disturbance. Second, we have the Wechsler Intelligence Scale, or WAIS. This is going to measure the IQ and cognitive capacity of the individual. Then we have the Hare Psychopathy Checklist, or the PCLR, which is used to assess or detect the psychopathic traits in criminals. Alright. Then we have the Structured Interview of Reported Symptoms, or SIRS. Again, this is used to detect fake or exaggerated symptoms. Then we have the Personality Assessment Inventory, or PAI. This is going to measure clinical syndromes and personality features. Okay, so these are the names that we need to remember. So MMPI is one of the most frequently used tools in exams, and we need to remember its full form also. It is Minnesota Multiphasic Personality Inventory, basically to understand the personality of the person. Then we have the Wechsler Intelligence Scale, then the Hare Psychopathology List, Checklist, Structured Interview of Reported Symptoms, and Personality Assessment Inventory. These are the names of the common tests that are being used in forensic psychology. So let's look at the personality testing in forensic psychology. Personality tests help understand who the person is, their patterns, their motives, and emotional stability. So the first and the most important test that we use for personality testing is the MMPI 1 and 2. We have already seen the full form. This is Minnesota Multiphasic Personality Inventory version 1 and version 2, right? This is the most trusted tool for detecting mental illness, abnormal behavior, or even lying. Alright, so this tells about the personality of the person who's under trial. Secondly, we have the Neo Personality Inventory, which is the revised version. Now, this is used for measuring the big 5 personality traits. And what are the big 5 personality traits? Neuroticism, extraversion, openness, agreeableness, and conscientiousness. So, if we talk about the big 5, if we discuss one by one each of this, then neuroticism, this relates to a person's emotional stability. So high neuroticism means the person experiences anxiety, worry, or mood swings easily. And low neuroticism indicates calmness and resilience. So for example, in forensic settings, individuals with high neuroticism may be more emotionally reactive during interrogation. So neuroticism basically is equivalent to emotional stability. Alright. Then the second one is extraversion. This describes how outgoing and energetic a person is. Extroverts enjoy being around people and are very talkative and enthusiastic. Introverts, on the other hand, are quieter, prefer smaller groups, and often recharge by spending time alone. So for example, in courtroom, an extrovert lawyer might thrive during cross-examination, while an introvert may prefer research and documentation. So here extraversion is equivalent to sociability and assertiveness. Alright. Then third, we have openness. This means openness to experience. This trait reflects how open-minded and imaginative a person is. People who are high in openness are more curious, creative, and like trying new things. For example, they enjoy art, travel, or learning new ideas. Those low in openness are more traditional, practical, and prefer routines. For example, a person high in openness might choose a career in research or design, while a person low in openness might prefer a stable job with clear structure, like a 9-to-5 job. So openness is equivalent to creativity and curiosity. Next, we have agreeableness. So this trait reflects how kind, cooperative, and compassionate someone is. High agreeableness is equivalent to being helpful, trusting, and empathetic, while low agreeableness means the person is more competitive, skeptical, or sometimes aggressive too. For example, a highly agreeable person would prefer compromise over conflict. A low agreeable person might challenge others openly. So agreeableness here is empathy and cooperation. Finally, we have the conscientiousness. This refers to how organized, responsible, and goal-oriented someone is. So high conscientiousness means disciplined, reliable, and good at time management, while low conscientiousness means the person is careless, impulsive, or easily distracted. So a highly conscientious student completes assignments early and keeps notes neatly. So here conscientiousness means self-discipline plus reliability. Alright. Then finally we have the projective tests. So projective tests are those which are used to explore the unconscious motives, like the Rorschach-Inkblot test and the A-perception test. These are two classical projective tools used by forensic psychologists. Projective tests are based on the idea that when when someone is shown an ambiguous or unclear stimuli, their unconscious feelings, thoughts, and motives get projected into their responses. So whatever their response is giving shows their unconscious thoughts and motives. For example, let's take the case of Rorschach-Inkblot test. This test was developed by Hermann Rorschach in 1921. It consists of 10 inkblot cards, some black and white and some colored. The person is asked what might this be for each card, and there are no right or wrong answers. The psychologist analyzes how the person interprets the image, and what it reveals the thought process, emotional control, and personality organization. The person can identify disorders like schizophrenia, depression, or personality disturbances based on the outcome of the inkblot test, right? So when it comes to forensic context, a person accused of a violent crime might show excessive aggression or distorted perception through their responses. Okay, so there are 10 ink blots, and each of those ink blot cards have some black and white or colored dots or ink blots, and the person is asked to interpret what that card with all those dots mean, right? And the second, we have the thematic apperception test. This contains around 30 picture cards showing people in various situations, and the individual is asked to create a story about each picture, what is happening, what led to it, and what will happen next. This reveals the underlying motives, conflicts, and drives, and even the emotional theme of the person, and is commonly used to explore aggression, dependency, guilt, or achievement needs. In forensic context, the thematic apperception test, a story of the thematic apperception test, if the story is full of violence or fear, this could indicate unresolved anger or trauma in an offender, right? So here this is a storytelling test which is going to reveal motives and emotions. So these are the main personality tests that we use to evaluate or study a person. Next, let us look at criteria for using psychological tests. How do we decide what psychological test should be used in a particular situation? So every test must be chosen very carefully, because this is a test, or the result of this test can potentially decide the future of a person, right? So according to this person Heilbrunn, who said that there should be certain criteria based on which test should be selected. So this person in 2001 said that the test should have high validity and reliability. We know what is validity and what is reliability, right? So validity means the test should be able to measure what it claims to measure. Reliability means the result of the test should be repeatable or reliable, which means if you do the test today, maybe after 10 days or maybe a week or maybe after a year, or if you perform a test in one city and then repeat the test in another city, the result should be consistent. That is reliability. So the test that will be used for psychological testing should have high validity and reliability. All right, and then the test should be standardized for the population being tested. So the norms should be similar to the target population. We know what is standardization also. All of this we have studied in our second year. So the test should be standardized and the norms should be clear for the target population. It must have strong psychometric properties. The results should directly related to legal question being asked, right? So it's not that the test is being conducted and you're getting a report or the result and it has got nothing to do with the legal question. No, The test should be chosen in such a way that the result should directly point to the legal question being asked. So always connect, the criteria with the idea of scientific credibility. The forensic results must always stand up in court. It should not be, something that even a lay person can come and say that no, this test is not valid, or this test was not suitable for this particular legal case or question. So once again, the criteria for using psychological tests, they should be valid, they should be reliable, they should be standardized, norms should be similar to the target population, it should have strong psychometric properties, and the result should always point to the legal referral question. Alright. Finally, let's look at the ethical considerations also. Ethics are extremely important because forensic evaluations affect real life. So the main ethical principles involved are objectivity. Objectivity means stay neutral, no bias or defense or prosecution, right? The forensic psychologist should not be taking sides. There should not be any bias and no emotional involvement with the person, right? Because this is a legal case. No bias for defense or prosecution. Second, confidentiality limits. The information that is being shared by the patient or the client, the information can go to court, has to go to the court. The forensic psychology cannot keep it private, right? So the confidentiality statement doesn't hold valid under ethical considerations in forensic psychology. Findings must be shared with the court. Informed consent. Here, the person need to be told why they are being evaluated, right? But they don't have any hold or the right in the data that is being shared. Okay. Since the evaluation is being court mandated, informed consent is also necessary. But it should also be made clear that whatever data is being or whatever information is being shared will not be kept confidential or private. Finally, avoid manipulation. So the forensic psychologist should watch out for any malingering or exaggerated symptom or deception. Means the people they are dealing with are potential criminals, right? So they might have an idea of how to manipulate you or how to exaggerate the symptoms. So the forensic psychologist should be ready to catch any such attempts to deceive you, or make a fool out of the psychologist. So, for example, a forensic psychologist should never promise therapy during court-ordered evaluation. That breaks the ethical boundaries because you are not there to help the person. You are there to help the court find whether the person is guilty or not, right? So, this is the ethical consideration that is involved in assessments in forensic psychology. So, that was all about this unit. So, to sum up this unit, we know that the forensic assessment is the bridge between psychology and law. It helps judges make informed decision about the mental state, responsibility and risk, whether the person should be sent for treatment or the person should be punished, right? And the methods that are used include interviews, tests, behavioral observations and collateral reports. Forensic psychologists also act as expert witnesses, presenting their findings in clear, unbiased language. So, if you are asked to explain the role of assessment and evaluation, make sure to link it to legal decision making and objective expert opinions, right? Next, we have the exam oriented questions. The questions that can potentially come involve explain the role of assessment and evaluation in forensic psychology, differentiate between forensic evaluation and therapeutic evaluation, describe the various tests and techniques of forensic assessment, discuss personality testing in forensic psychology. So most of these questions would be like 5 marks question. I mean, there is not much 10 marks essay based question chance from this chapter. So yeah, you can prepare accordingly. Alright. So that was all about unit 3 of the block 1.
Thank you all for learning with me. If you found the video helpful, make sure you let me know by hitting the like button. Make sure you share the video with your friends too. Subscribe to make sure that you don't miss out on any of the new videos. You can reach me by simply dropping a comment. See you in the next one. Till then, happy learning.